The next two speakers I'm really excited to introduce, Dr. Lovinsky-Desir and Dr. Melissa Stockwell. Dr. Desir is an associate professor of pediatrics and environmental health sciences and is the chief of the division of pediatric pulmonology at Columbia NYP. Dr. Lovinsky-Desir's research is focused on understanding and addressing the environmental factors that contribute to childhood asthma, especially as it pertains to urban communities. And Dr. Stockwell is the Felice K. Scheer Professor of Pediatrics and a Professor of Population and Family Health. She is also the Chief of the Division of Child and Adolescent Health and is the Director of the Center for Children and Digital Health Research. Dr. Stockwell's research focuses on translational interventions to improve vaccinations with an emphasis on health technology and health literacy. You're welcome.
We have the inevitable position of being right before lunch and running late. So you heard how someone from DC can talk fast, and now you'll hear a New Yorker, although I don't think we're anywhere near as funny, so sorry. So what is digital health? So there's a lot of definitions. One definition is the use of digital technology to deliver healthcare services or to facilitate better health, even on a population level. And there's many, many ways that that can be done. But research is important. And for example, the World Health Organization stated to improve health and reduce health inequalities or health inequities, we really need a rigorous evaluation of what they called e-health, which is the same as digital health, so we can generate the evidence and we can promote the appropriate integration. So what Stephanie and I thought we would do is we would just take you a very quick tour through some of the ways that we have integrated the use of digital technologies into our research with the hopes of overall improving population health. So just to orient you very, very quickly, this is one of the many models when you're looking at vaccine hesitancy. And this is, we sort of redid the model for the WHO, but focusing on flu or COVID. So at the very, very basic level, you need to know what people think and feel, right, about the vaccine and the disease. You need to know about social processes, so what's happening in the community. You need to motivate people to ultimately get vaccinated, but then there are practical issues, right, to know where to go, how to go, et cetera. But you have to remember, right, that there is this individual who is part of a family and a community. There's an organization, right? There are all of us. We all live in a community, and then there's society. And so lots of ways that we can use digital technology to be able to, or health technology to be able to affect under vaccination. And this model is called the sociological model in public health. So what can we do? Just a taste of what we could do on an individual level. So here we want to, again, focus on that, what people think and feel. We have done a lot of work using text messages as a way to promote vaccination through giving health information. This is one of our studies, the American Academy of Pediatrics, through the Practice-Based Research Network called PROS. This is our biggest study. We took about 2,000 kids who are 6 months through 8 years, who were in need of 2 doses in a season. So for those of you who are not in general pediatrics, there are a number of younger kids who, when they're either their first season or their second season, depending on their first season, need 2 doses in that season. And we know about only half of them ever come back in the season to get that second dose. And of those who come back, they may be coming back very at the end of the season. So we all are right now living through our current flu peak. And you can imagine if we get everybody vaccinated in April, that's probably not going to do much for them right now. So in this study, we took half of the kids or families and gave them text message vaccine reminders with educational information, and half didn't. And you can see right at 28 days, that's our minimal interval for that second dose. You start to see an increase, and then you see this really nice spread in timeliness of vaccination. In this particular study, by the end of the season, that difference decreases. What we really worry about it is that timing. Again, remember, we want to get everybody in for their second dose while there is still flu around. Okay, so that's what you can do on an individual level. What about family, friends? All of you know when people don't get vaccinated against flu, they're saying, well, I got sick, or my child had a fever, or my friend had a fever. And so we were really interested, along with the CDC, in understanding how can we collect that patient level information, right? So we're not collecting this at the organizational level, we'll talk about in a second, but at a patient level. This particular study, we were interested in, could we understand rates of fever after vaccination, because that's what people are often very worried about. This one was looking at 2 different types of vaccination, so intranasal flu versus injectable. This was focusing on this specific age of 2 through 5 years, and we were following them over 10 days after vaccination. This is one of our first studies, and the reason why I want to show you this one is in order for people to move towards using text messaging as a way to collect this kind of data, we had to prove that you could trust the data. So in this case, that top box is all sources. So the old ways to do it with a paper diary, phone calls, and text messaging. And that bottom box is text messaging only. And you can see here, looking at our frequency of flu vaccination overall, as well as our adjusted relative risk, it's basically the same. So this gave everybody confidence that you could use text messaging as a way to be able to get this information. And for those of you who did sign up, not many people did, for V-Safe after the COVID vaccine rollout. This was it's different than what we did research-wise with CDC, but this was CDC's use of text messaging for vaccine adverse event tracking. Now, of course, all of these people are now coming to us, right? So what do we do, right? They show up, and how do we remember to make sure that we give them their vaccine? In this particular study, we were looking at vaccine alerts. This was a different kind of trial. It's called a randomized cluster crossover trial because it's at the practice level. But again, those general pediatricians will tell you it's very different, flu in the fall versus flu vaccination later. And so we wanted to make sure that sites had the opportunity to get this vaccine at both periods. And what did we find? The first thing is that we really worked with providers to ask them, what do you want this alert to look like? What's going to be useful for you? What's going to really annoy you? And so we really had a lot of user design in this. And so the percent of providers who acted on the not up-to-date alert was very high. And this was shocking to our biomedical informatics colleagues, because usually everybody hates alerts, including all of us. And this was not a forced action alert. So you could ignore it, but people really chose to act on it. The second thing we found was it didn't really matter in the fall, right? So you remember, everyone coming in, you're offering flu vaccine, flu vaccine, flu vaccine. But where it made its difference was in the winter, right now, where we really need to keep offering, right? Keep offering to those kids who didn't come in, or for those who already said no, because we never know when that conversation may change. Okay, what about the community? So similar to the vaccine adverse events, we also know that people say, if I point to my general pediatric colleagues, why don't you want to get the flu vaccine? Oh, I'm not at risk, right? Or flu is mild, right? Or COVID, you'll hear, right? COVID is mild, we don't need to be vaccinated. So also with CDC, we designed a way to be able to conduct community surveillance using text messages. The old school way of doing it was to call everybody, which is basically takes a huge amount of time. But we were able to show, again, the evidence that you can use texting as a way to be able to get that information quickly. This then actually rolled out during the pandemic, when we all had to quickly figure out how to do all of this. And we were part with CDC in 2 studies, one focusing on pregnant women and one focusing on household transmission. I can't go through all the methodology, but there was antibody testing, there was weekly text messaging surveillance, and there was weekly swabs. And we found some really important information, which was very, very important for CDC at the time. The first thing was that the incident rates of COVID in children were much higher. So remember, at that time, everyone was saying, oh, kids don't get COVID. It's because no one was testing them and they weren't coming in for care. But the rates were much higher than they were modeling, and they had to change their whole modeling. Second, adults, children, and pregnant women were all at similar infection risk, but because we were doing this swabbing, we could see that among children, half of infections were asymptomatic. So the family had no idea that this child was sick, but again, they were a potential infectious risk to the household. Pregnant women were kind of in between at 35% and adults at 12%. We also found fever to be a very infrequent, not very, but an infrequent symptom. So all that time had been using fever as the way to decide if it was COVID or not. That actually didn't make sense and missed a lot of infections. We found that households were a very common source of transmission. And we found for the pregnant women that having a school-age child, not surprisingly, increased their risk of transmission. So again, these 2 together provided very important real-time information as the pandemic was happening. Finally, we are all part of a society, and the CDC has to figure out, as they did this fall, who are they going to say should get vaccinated, who do they say should get boosted. This is a pooling or a big data study. You're going to hear those that go in the breakout into big data. You'll hear more about those kinds of works. This is a CDC network called Vision. We're a part of it. It's now Vision 2, and this is going through biomedical informatics with lots of EDs, urgent cares, and hospitals throughout the country. Basically, every week there's data dumps of kids, of people who are, this current year is going to be COVID, flu, and RSV before it was just COVID, to understand vaccination and to understand infection. And there's a lot of studies, adult and pediatric, that have come out of Vision. But just to show you two of them, we were able to show that for those young kids, it really was that if they did get that bivalent dose, that booster was high, regardless of manufacturer. So again, important that we are vaccinating those young kids, and that looking at Pfizer vaccine, particularly for those school age to adolescents, we did see effectiveness against mild to moderate as well as severe COVID. And that, not surprisingly, the vaccine effectiveness was lower for Omicron than it was for Delta, right? We could have told you all of that as well. And it does wane, but again, when you get that booster, it does go back up. So again, important that we keep people up to date. Again, this is always a village, so a research team and our funders and all of our collaborators, and I'm going to hand it over to Stephanie.
I'm going to start with my acknowledgements. I'm just going to share one study with you that we've been working on as a pilot with a hope for expanding this into the future. And I really want to acknowledge my partners here. So this study team was made up of Adina Kazuku DeLuca, who is an undergraduate student at Columbia. And then that's me. And then there's Genesis Abreu, who is our community partner at Futures Ignite. I'll tell you a little bit more about that work that they're doing. Rachel Youngwood is a high school student who did a project with us this summer, and Meghna Giri, who is going to be presenting a poster later on this afternoon, is a medical student here at Columbia. So I point this out because we are able to encourage and engage people at a variety of different career stages and levels in research that we're hoping to be very meaningful and impactful for the community. And so again, I acknowledge our community partners, Genesis Abreu, Thalia Flores Perez, Diana Varallo, and Jared Fox, who were part of this project that I'm sharing with you today, as well as our funders. So many of you recognize this picture, many pictures like this taken in June of last year when the skies were orange and everybody was like, what is happening? And I think there's no better picture to illustrate the burden of environmental air pollution in our community as these two adjacent photos. And this here is the George Washington Bridge, which is not far from where we are, very close to the school that I'll tell you a little bit about. And believe it or not, it's the most trafficked. Oh, I just see Rachel's in the back. Sorry. You know, this is the most heavily trafficked bridge in the world. 250,000 vehicles pass through the George Washington Bridge every single day. And so imagine what that means for the people who live in this neighborhood, in this community, who have to breathe the air that it comes with, particularly diesel exhaust pollution. And then obviously made worse when we have wildfire smoke coming through from Canada. And so I've had the fortune of working with this organization called Futures Ignite. They are an environmental justice organization, one among many. I see we have a representative here from South Bronx Unites, which is another community-based organization. I think we're all waiting in this room for the next breakout session. But what the folks at Futures Ignite have been really working on is how to educate teens and youth in school about issues related to environmental justice. And so as part of their environmental sciences course at the Wheel School, the Washington Heights Expeditionary Learning School up on 182nd Street, they've done a lot of work sampling and learning about the environment with which they live and they go to school, and sampling the air quality as well as other exposures in their neighborhoods that can be related to their long-term health. And so this is a project that they call the Clean Air Green Corridor Project, where they're advocating with local city legislators to pedestrianize this street that's adjacent to their school on 182nd Street, as well as 5 other schools that are on that corridor. And the goal is to create traffic barriers, to limit traffic in that area. This is a space where kids can, go out for recess and play and sort of be active and engaged. And I, a couple of years ago, happened to hear a little bit about the work that Futures Ignite was doing through another community partner, We Act for Environmental Health. And I joined one of their meetings and I said, I'm a scientist. I study at the medical center. Is there anything that I can do or that our team can do that can be helpful to the work that you guys are doing here in the community? And Jared Fox, who was the environmental sciences teacher at the time, he said, I'd love to do a backpacking study. And what he meant by that was a personal air pollution sampling study where we could see directly what are these kids exposed to and use that information for the advocacy efforts. I was like, I could do that. I've done that in many studies. So this is an example of one of the studies. For this particular pilot project, we use this UPass monitor, which samples the air and the breathing zone of the children every 30 seconds. They use that paired with this Garmin GPS tracker, so we could map out where exactly the kids were exposed to what concentrations of pollutants. And this is a picture here of a volunteer wearing the UPass we created this harness. I just ordered on Amazon, those fanny packs for running, and we cut some holes and outfitted it to make it user-friendly for our students to wear for this project. And we kind of worked within a program that was already existing. So Futures Ignite had developed a summer program for these students where they came in and they did environmental assessments throughout 6 weeks of the summer. And so we said, hey, we'll put this together and you guys can wear it and we can see what data come out of it. And so this was created by Adina, so it's her picture there. And what you can see is an example of 3 participants who were wearing these monitors at the same time. A highlight for you, you can see there are certain spikes that happen at certain periods of the day. Not every child is exposed to these same concentrations, but there are some general patterns of what their times during the day and locations where they may or may not be highly exposed. Like, for example, this is a peak in the morning commute that we saw, particularly for one individual who commuted via subway and bus to get in. And then what was really important to us was how are we going to communicate this information back to these students in a way that they can use. And so Adina, with the help of Rachel and Meghna, put together report backs where they actually took maps with each individual's data, and they showed them when you were on this street at this time, this is how high your exposure was. But when you were on this street at this time, it was a little bit lower. And we're hopeful that giving this information back to the students not only encourages them in participating in this type of research, but it helps to empower them. It's funny, we asked them, did they want to see everybody's data compared to their own? They were more interested in their own data than how they compared to everybody else, which I think for teenagers is not too surprising. But the idea is to get young people really involved and excited about this type of work. And ultimately, the goal is to integrate multiple digital technologies so we can identify where and when kids should be walking on which blocks at what time to help reduce their overall exposure. So with that, I'll leave you with a quote that brings us right into lunchtime. Every once in a while, a new technology, an old problem, and a big idea turn into an innovation. Thank you.